Kathy Bennett has treated her HIV infection with a combination of antiretroviral drugs for the past 22 years. She says her life is as normal as that of an uninfected person.
I'm doing well, I'm stronger, I'm doing all the things that I wanted to do in life.
Researchers say antiretroviral drug therapy has improved the life expectancy of HIV patients by 81% in the United States and other developed countries. But in poorer countries, HIV/AIDS still claims many lives, mainly because of a lack of effective therapies for HIV-positive patients. Things began to change about a decade ago when the first antiretroviral drugs became available in these countries. A new study done in the East African nation of Uganda found that HIV-infected patients getting antiretroviral treatment can expect to live as long as people who don't carry the virus, an average of 55 years. Dr. Edward Mills is one of the study's authors.
This is the first study to look at life expectancy in Africa. What we found is if a 20-year-old individual can begin treatment before they become ill, they can expect to live an average of about an additional 27 years. It's slightly less for men than it is for women because men tend to access care at a later stage.
Dr. Raymond Martins, the Chief Medical Officer at the Whitman Walker Clinic in Washington, specializes in the treatment of HIV/AIDS patients. He says he's pleased by the findings.
To me, it's not surprising. So if you look here in the United States, there's been a lot of studies that have shown normal life expectancy. People are on HIV medications. To me, this is where the HIV medication side effect profile is very important. But it looks so far, the medications are very effective and without a lot of side effects.
Medical experts say the study also points to a major new challenge for public health agencies in developing countries: how to provide effective medicines and support services for HIV/AIDS patients as they face the health problems of old age.
We believe that these findings are very important in terms of planning for a long-term epidemic, which also means we have to plan for chronic diseases associated with aging.
Researchers say the pressing question now is whether they can mobilize the funding needed to close the gaps in HIV/AIDS treatment around the world. Vidushi, Sinha, VOA News, Washington.